mynews.studio.
Picture a single encrypted dataset, one that could actually change how nations respond to the next pandemic. But the key question is, will countries be willing to share?
Today is June 4th, 2025. The World Health Organization just rolled out its new Global Health Data Transparency Framework. This sounds like a big shift. Why is it important?
At the heart of this is a simple but pretty radical idea: treat health data as a public good. That means not just collecting and analyzing information, but making the entire process, how it's collected, stored, and shared, completely open. Think of it as adding clear metadata, context notes, and open explanations for every dataset.
Is this in direct response to what we saw during COVID-19? The confusion, the trust issues, the delays between countries sharing information?
That's right. The pandemic really exposed some gaps. Countries often hesitated to share data, or shared it too late, which slowed down the global response. With this framework, developed alongside the World Bank and others, the goal is to make health data both dependable and widely available, so decisions can be based on solid evidence.
But what does it actually look like in practice? How does this framework change things day to day?
One of the most visible changes is the 2025 World Health Statistics Report. It now brings together data from all over the world on the health-related Sustainable Development Goals, SDGs. So countries are measured against shared global targets like life expectancy, early mortality, and vaccine coverage, all using methods that are transparent and standardized.
So these numbers in the report aren't just isolated stats. They actually show whether countries are complying with this new transparency push.
Exactly. The idea is to set a new standard for sharing accurate, up-to-date information. That should help countries act faster during health crises and, hopefully, help restore some of the public trust that was lost during the pandemic.
But health data is sensitive by nature. How does the framework handle privacy concerns?
That's a core part of the plan. Health data is officially recognized as sensitive personal information. The framework introduces new legal and regulatory safeguards. Member states need to agree on strict safety protocols, have clear consent processes, and put in place systems so people can see their own data. There are also requirements for audits and clear lines of accountability.
And what about interoperability? Data often gets stuck because systems can't talk to each other. Is that addressed here?
Yes, that's central to the framework. The guidelines set out general legal conditions for interoperability, so countries are encouraged to build digital health systems that can exchange information quickly and securely, no matter the platform or country.
But implementation is almost always where things get complicated. What challenges are they anticipating?
They've identified 4 big ones. First, digital infrastructure. Some countries have strong systems, others are just getting started. Second, there's the tension between privacy and transparency. Third, achieving true technical standardization is a complex job. Fourth, many countries simply lack the funding and workforce to make this happen.
Is there a plan to actually close those gaps? Or is it more of a wish list?
There is a plan covering 2025 to 2028. It focuses on strengthening national data systems, providing technical support, and improving WHO's own data management. The main goal is to help every country get the basics right: timely, reliable, and actionable data, so that no one is left behind.
But does this framework actually require countries to share data or just encourage it?
It doesn't outright force countries, but it sets strong expectations and clear incentives. For example, if a country wants funding from the World Bank, transparency is now a requirement.
Why should people who aren't in the health sector pay attention to any of this?
Because transparent, reliable health data is the backbone of everything from public health policy to outbreak response to fair distribution of resources. When data is missing or unreliable, as we saw in the pandemic, the consequences are serious. This framework is designed to prevent that from happening again.
So, if it works, we could see faster pandemic responses, more public trust in health systems, and better outcomes overall. But that's only if countries actually take part and build the needed capacity.
And that's the key. Will countries cooperate? And can those with fewer resources get the help they need?
We've gone through what the framework is, why it matters, and how it could work. But the real story will be in what actually happens next.
That's a wrap for today. One shared global dataset has the potential to change everything if countries are willing to participate.
Thanks for tuning in. This episode was brought to you by mynews.studio. Try it out for free.